Yeah, thank you very much, and hi everyone. I will be taking you through the next few slides. Probably, if you need some clarification, probably you will be dropping your in the chats, and we are going to respond towards the end of the slides. Mainly, I will not be talking much about this slide. We are going to provide you with a lot of reference materials towards the end. Next slide, Zeina. Yeah, as you know that we are currently implementing MAMI program in Somaliland, and Somaliland is at the Horn of Africa. As you see from the map, it's located near Ethiopia and also to the Red Sea on the south. So we have been implementing MAMI for the last 2 years as part of MAMI LDS supported project, which has been piloted for the last 2 years, and we are going to continue for another 1 year. Next slide. Yeah, as you know that these barriers might not be something that is only limited to Somaliland. And as you know, they have potential of hindering access to quality service in terms of providing quality service for infants less than 6 months. Apologies. Infant less than 6 months with disabilities and their mothers. And it is something that probably you have also identified and also came across in your area of setting. And in Somaliland, the barriers that we identified includes delayed detection of disabilities in infants. You know, it is really very challenging to identify disabilities in infants towards the first 6 months. And as you know, early detection is really critical when it comes to identification of disabilities. And it is really good for time intervention. But unfortunately, due to several factors, which includes probably lack of limited routine screening, something related to the capacity of the staff, early detection was really a challenge in Save the Children in Somaliland. And that is one of the barriers that we have identified. The second one is stigma and discrimination in communities. As you know, stigma runs across everywhere, and disability is usually being viewed, unfortunately, as it's being misunderstood and viewed negatively, which leading to stigmatization in the area. So in Somali setting, where we are currently implementing the program, there are some fear of being stigmatized if a mother with a child with a cleft palate or probably something like cerebral palsy comes to a facility for service. So discrimination runs across in the community, and it's a barrier that we have identified. Assumption and inadequate knowledge among the healthcare providers. Without proper training, it is very challenging and disturbing itself in terms of even before diagnosing a child or a mother with a disability challenge. Because if the staff who is diagnosing does not have proper knowledge or proper capacity, he can easily be diagnosed and hence affecting probably the mental health of the mother. So it was a very big challenge. The other thing was also a communication issues. If a mother cannot hear properly, giving support or diagnosing a mother with a child with a hearing impairment is really a challenge because there is no training for the staff on communication sign languages. The other challenge that is really a big one in terms of Somaliland is the purchasing power amongst the mothers. There are some family-headed households, female family-headed households, and they have challenge of getting the purchasing power to run their family, and even getting the transport to go to a hospital to do the screening for their children is really something that is a challenge and a barrier to taking a child for screening for disabilities. We are also working in very inaccessible health facilities, hard to reach areas, mainly not in terms of securities, but in terms of infrastructure. In Somaliland, there is no any security issues. All the areas accessible, but it is because of the distance and also the poor infrastructure and also the shortage of the referral vehicles that are normally transporting the patients to referred health facilities. So it was really also a barrier that we are fighting. The other thing is weak disability inclusive policies. Currently, the only policy in the country, Persons with Disability Act, it was passed on December 2024. Somalia president ascended recently, and before that, there was no any disability inclusive policy. It is only now that all the ministries have been informed to include disability inclusive into their ministries, into their policies. But it was there is really weak disability inclusion policy in the country. The other challenge or the barrier is the humanitarian context that we are also fighting. And, the whole area is being affected in terms of the droughts for almost how many years? There is no rain. Yeah, thank you. Next slide. Yeah, in this regard, Save the Children worked together with the Spoon Foundation, because as you know, we have been implementing MAMI, and the first thing first was to make sure that our program is inclusive, to make sure that the children who are identified with disabilities are supported in all our operations, not only in MAMI, but also across the country. So Save the Children, with the support of our member, we collaborated with the Spoon Foundation to facilitate a training, develop a training guideline, and also resources to support the programs that we're implementing. And that's how we brought on board Zeina, our consultant, who helped us to develop all these tools. As you see from this photo, we have the frontline health workers. We have Save the Children staff. In between, we have also Fred, who is our disability inclusion technical specialist. He's not with us today, but he's going to join us in the next 20 minutes. He's currently in another workshop. And also we have Zeina. All these staff who are sitting here, apologies. All these staff who are sitting here have also received the MAMI training. Majority of them, they have the MAMI training, all of them actually, and they are being trained on disability inclusion as far as this training is concerned. Over to you, Zeina.
Thank you, Mahat. Thank you all for joining us today. So I'm going to give you an overview of the training and what it entails. The training has 6 modules, and it focuses on core competencies in several areas, including understanding disability and inclusion, understanding the connections between disability, feeding, and nutrition for both the infant and the mother, identifying feeding difficulties in infants with disabilities, and then strategies to address these feeding difficulties, focusing on the functional difficulties in feeding rather than the diagnosis. With maybe one exception, we have a module on how to address feeding difficulties for infants with cleft lip palate because of their unique feeding needs. We also have a module on supporting mothers with disabilities and mothers of infants with disabilities, and also some core competencies on how to integrate disability into MAMI services, which could also extend to other health services. So I'll walk through in a bit more detail kind of through these different sections. The training, if done in full, takes about 3 to 4 days. In our case, we use the full 4 days with our frontline healthcare workers in Somaliland. That included pre- and post-test training evaluations, all the tea and lunch breaks, and a session on the last day for implementation, to discuss implementation. And so if your participants already have knowledge around disability, if they're already familiar with the intersection between nutrition and disability, you may be able to condense the training to maybe 2 to 3 days. We still encourage to give a quick overview of the first 2 modules that are around disability and the intersection between nutrition and disability, so that everyone has common language when they talk about disability and common and a shared understanding of the barriers. So the training is very interactive. I think I counted maybe over 30 activities that include group discussions, role play, demonstrations, and case studies. It includes lots of tools and materials like handouts and activity sheets and job aids. It also utilizes existing MAMI tools. So from the care pathway, we have the MAMI assessment forms, the MAMI feeding assessment forms, and the maternal mental health assessment forms that are built into the training. We also rely for the counseling recommendations and sessions. We rely on the MAMI counseling cards and support action booklet. Now, there's a generic one, which is referenced in the manual, but in Somaliland, they had already customized and translated the MAMI counseling cards and support action booklet. So it was a very nice addition to the training that we've done in Somaliland. Now, of course, we encourage using the country-specific counseling cards, but if those do not exist, then the generic ones are referenced in the training. So the training kicks off with a 1-day session focused on understanding disability and understanding inclusion using the psychosocial model, biopsychosocial model of disability and the WHO's International Classification of Functioning Disability and Health, or the ICF framework. So our participants were able to apply the ICF frameworks to different disabilities to help them understand that intersection between a health condition and the environment, which include the barriers that infants and mothers often experience. And we really wanted to challenge that those perspectives that are very rooted in the charity and medical model of disability, which I know is common in a lot of countries still. And we wanted to encourage frontline healthcare workers to think more, or to shift their mindset into a more inclusive approach as they provide services to infants and mothers. We also had a pretty extensive discussion around the barriers that infants and mothers with disabilities come across as they access MAMI services and other healthcare services. So the frontline healthcare workers thought through barriers within their own context, and then given their role, what is it that they can do in order to minimize these barriers? Then we move into more kind of the meat of the training, which focuses on understanding the types of feeding difficulties that are common among infants with disabilities, and then learning about different feeding strategies to address those feeding difficulties. Now, Mahat mentioned that it might be difficult to have a diagnosis of a disability before age 6 months. That's because sometimes it may not become apparent until later, when developmental milestones are not met, or because of maybe lack of tools and diagnostics in the setting. And so our approach is to really focus on the function of feeding rather than waiting for a formal diagnosis. And for infants, in order to identify feeding difficulties, you must take a systematic approach. And so I want to highlight one of the tools that we have included in the training. It's a checklist, and you see a screenshot on the slide. This checklist, it can be used as a job aid by frontline health workers, or even a learning tool as you train on how to manage feeding difficulties for infants. And it allows you to systematically look at key aspects of feeding during 3 phases: before feeding, during feeding, and after feeding. Now, notice that the checklist doesn't mention diagnosis. So it's really based on the function of feeding. And then once you systematically identify the challenges, you could then think of the targeted interventions to address those issues identified. Now, yes, we focus on function of feeding and not the diagnosis. However, it's important to know some of the common symptoms for certain conditions and the common feeding difficulties that are associated with certain types of disabilities, because that can help you anticipate some of the concerns and can help you know what to look for. And so you can be prepared and have like some strategies in your toolbox to consider as you counsel mothers. And so just for the sake of an example, if we have an infant with cerebral palsy, we know that often children with cerebral palsy experience issues with their tone. So if we have an infant, let's say, with high tone, or it's when their muscles look very stiff, they may have difficulty coordinating their jaw, tongue, and lips in order to support efficient feeding. They may also have a very difficult time maintaining a safe and stable position while feeding. And so if I know that there's a child with high tone that I'm seeing, I can anticipate some of these signs of difficulty. And using the checklist, I could kind of think through these 3 parts of feeding. So before feeding, I might see stiff muscles. During feeding, I might see that the infant is experiencing frequent loss of latch and or shallow latch because they might not be able to open their mouth wide enough to have a proper latch. They may also tire quickly after feeding because of the inefficiency in which they're breastfeeding. And so kind of thinking of those, I could then think back to strategies that I learned during the training that could help me address some of these issues identified. The checklist can also be used during a visit with a mother or a counseling session as you observe feeding as a job aid to kind of help guide you through systematically observing feeding and kind of dissecting it into these various important aspects to look at. And so for strategies for this infant, I may consider working with the mother on some breastfeeding positioning to address that could be supportive of an infant with high tone, like underarm, or maybe a dancer's hold to support with a proper latch. Maybe consider counseling the mother on shorter, more frequent feed if they tire easily. Now, the good thing is a lot of these strategies, at least in Somaliland with our frontline healthcare workers, and most likely with any participant who has completed the MAMI training, they would be familiar with a lot of these feeding strategies. And so what the training does is really build on that knowledge and on that on those skills and knowledge in order to help them problem solve feeding difficulties for infants with disabilities. So for example, in Somaliland, the frontline workers knew various breastfeeding positions. And so it was about kind of talking about when to apply different strategies for some of the common difficulties. So they were able to apply their knowledge and skills in new and more targeted ways. The module on supporting mothers with disabilities provides strategies to provide services and support and counseling for mothers with various types of disabilities, deaf or hard of hearing, blind or partially sighted, physical disabilities, and intellectual disabilities. And we know that mothers with disabilities may experience additional barriers, such as lack of access to information, stigma and discrimination, and sometimes some misconceptions about their ability to breastfeed. In the training in Somaliland, based on request from our participants, they wanted the focus to be on how to support mothers who are deaf or hard of hearing. And so we spent some time doing activities on building their confidence on how to communicate with a mother who is deaf or hard of hearing, using gestures and facial expressions and basic sign language. One of the highlights during that session was one of the frontline workers had a video of a counseling session that she has done with a mother who is deaf, and she was able to share it during the training. And it was a really great demonstration to her peers for how an inclusive and a positive counseling can look like. We also were lucky to have the Save Somalia team lead a brief tutorial on sign language. And so that was a nice addition to the training. And finally, the training concludes with comprehensive case studies on infants with disabilities and mothers with disabilities. And so during those case studies, the participants use all of the MAMI assessment forms, the counseling cards, as well as that checklist that I shared with you, in order to identify the feeding difficulties, develop strategies to address them, and then develop a care plan for the infant and a counseling approach for the mother. So they were able to put together the things that they have learned throughout the training and apply them to various scenarios and case studies. And Mahat, I'll turn it over back to you for the last part of the presentation.
Thank you very much, Zeina. This is a case study. After the training, all the participants or the frontline health workers, they went back to the facilities and they started diagnosing all kinds of disability in children wherever they find. This is a typical example of a child with upper cleft palate. The mother, she has been referred from a nearby village. This is her third child, and she has not experienced any cleft palate previously with the other two children. Our staff identified her, and they referred her to a facility on the 15th day. By then, she could not do anything. She was devastated and she was not able to do anything. So they properly gave her a proper counseling in terms of the approach of the child on the best way to feed. For example, they were using a specialized feeding cup by raising it, and also sometimes using an NG tube. They were helping mothers to express the breast milk properly to make sure that the child is fed on the breast milk, and to make sure that the mother does not lose her mental health. She had frequent visits, and currently the doctors promised that the child was too small previously, and he is going to be operated next month for corrective surgery. And we are currently working to get the necessary support for this family, because they are going to have a free corrective surgery in the nearest hospital, the Hargeisa hospital, and everything is going to be supported, and we will make sure that the child is properly taken care of. This is a typical case. There are several others. Since the training ended, the staff identified a number of disabilities in these children. It included one with a blocked ear, and that one also is going to be operated soon for corrective surgery. There are several mothers that have a hearing impairment, and they are practicing very well the knowledge, and also they are doing the sign language properly for good counseling. Next slide, please. Yeah, these are the main lesson learned. And the first thing that the staff requested, or the frontline staff requested after the training, was additional training, because they really appreciated the training since it was more of practical, as you saw from the picture. They requested for additional trainings and also to practice more hands-on in terms of the field. Already they have, they received a lot of hands-on experience while in the field, and they are doing excellent work. Recently, we have done post-training evaluation, and we are working on that in terms of finalizing, and we are going to share very soon with our senior team in the member. But the staff, they said that since this training is something that's life-changing, we need additional training. So the second thing is we have identified that there is need for culturally appropriate videos and photos, because as you know, during the training, Zeina and the consultants, they were using videos that they try to put from different areas. So it's best that we get also videos and photos for future training that is going to be supported. And you know, people normally ease of take up when they see something that they can easily relate on. The third is there is need to promote and reinforce biophysiological model of disability among the infants. As you know, this is really very, very, very important, because it is, as we know, disability sometimes we look from the perspective of the medical model for broad understanding, but we have also to transition to make sure that we understand things from different angles, not only the medical, but the staff, they will be able to see that there are a lot of factors, social and environmental factors, that can easily support when it comes to disability. Next slide. These are the key recommendations. The recommendations are actually quite a number that we had to give. As you know, always we cannot have capacity to hire a consultant. So it is in a long term, it's always advisable to have a national pool of trainers with a capacity to facilitate and also to pass knowledge to the frontline health workers. You know, always there is that need to have training. So if we have in-country level a pool of trainers who will be able to provide the required knowledge and skills, it's really advisable. That's why we say continued capacity building. And as we go along, you know, always when we go to the field, we should provide mentorship and also peer learning. Sometimes we have to transfer the person from one facility to another for proper counseling, for proper capacitating. That is how someone learns by ease of seeing. That mentorship program is really very important. The other thing that we also recommended through this after this training was to mainstream disability into future MAMI trainings. All MAMI trainings should have aspect of disability inclusion. You know, we know that the MAMI trainings is 5 days, and literally disability inclusion can also take another 4 or 5 days, but easily we can integrate or mainstream the disability inclusion into the training. It's not must that we take all the slides into it, but the most important and critical ones. That is after capacity. We also talked about we have to implement disability inclusion in all our feeding. You know, as Zeina said, that the staff have capacity in terms of IYCF. They have more knowledge than anyone else. They know because they have been implementing IYCF program in the area. And but previously they were not focusing on those children that have disability in the community. But we have to make sure that all our policies in terms of IYCF, in terms of IMAM, all of them, we have to make sure that it has disability inclusion activities. And also, we have to make sure that we have to promote an enabling environment. You know, as I just talked about previously, the ministry currently, all the different ministries, including Ministry of Health, Ministry of Education, they are putting a lot of emphasis into inclusion for disability. There is currently an ECD program that Save the Children is running that is inclusive with disability. But we have to push in terms of making sure that all our programs, in terms of even our quality benchmarks, the community support that we provide, all to make sure that we fight the stigma to the end. That is the most important. And we have to make sure that our communities are well sensitized and we have all the documentations in terms of policies are all in place. Next slide. And finally, these are the resources that we talked about. I'm sure you are going to have access to them, all of them. And yeah, back to you.
Nikki, over to you if you would like to go through the resources.
Thank you, Zeina Mohammed. That was very clear and comprehensive. And we will be talking in the discussion about the availability of this package soon from Save the Children, and the presentation recording will be shared. These are just some resources we wanted you to be aware of as well, because we didn't go through all the background of nutrition and feeding difficulties. There is a brief that we've done in English and French for ENN. There is a huge feeding disability resource bank managed by UNICEF, previously by USAID. And there was recently a webinar and a new tool that's also for emergencies through the Global Nutrition Cluster. So just so that you're aware of those, they will be shared after this meeting.